My name is Elisa Collins, and I am a nurse practitioner and the CEO of Discovery NP Legal Consultants. When I entered the legal nurse consulting arena, I found there were some major issues. First of all, advanced practice registered nurses, or APRNs, were being underutilized. So I created the first online community of advanced practice registered nurses and nurse practitioners who wanted to contribute as consultants to the legal profession. And in the unregulated industry of behind-the-scenes medical consultation for legal services, I coined an entirely new credential for advanced practice registered nurses who are serving as consultants to the legal profession. We call ourselves Nurse Practitioner Consultants to the Legal Profession, or NPCLP. I considered it my mission to help educate attorneys and help them discover the NP advantage. Nurse practitioners, or NPs, diagnose, we prescribe treatments and medications, and in the United States, we have a lot of autonomy to practice nursing at its highest level, on par with physicians. This allows us to critique the work of a physician just as legitimately as we can a nurse's work. The second thing that I noticed in the legal nurse consulting industry is that attorneys were functionally limited on who and how many individuals they could consult in the pre-litigation behind-the-scenes consulting phase, because each consultant would want an individual retainer, when it would be so much easier to just have one retainer and access to multiple specialists' eyes and opinions, not to mention the simplicity of billing for that attorney's accounts payable. I also learned the work product that most behind-the-scenes registered nurses were generating lacked the versatility and utility that modern collaborative softwares could afford for the legal profession. A lot of the training out there for legal nurse consultants was being passed on either directly or indirectly by just a handful of legal nurse consultants who've been around since the inception of this role. So the work product that these attorneys were getting was adapted year by year from the 1960s and 70s, rather than being engineered in the modern world. Attorneys were using frozen chronologies that came to them on PDFs that were built out of a Word document. So they didn't have the freedom and the versatility to be able to adapt the work product as new information flowed in through the process of discovery. The work product rightly belongs to the attorney, and so they need to be able to adapt it and utilize it in whatever way they see fit, and to organize it in a way that makes sense for them. The next thing I noticed was that the behind-the-scenes consultants working independently were spending way too much time and billing the attorneys hourly to research things that they weren't familiar with. They weren't collaborating with each other to be as efficient as possible with their time and your money. No one had thought of taking the collaboration that was going on in the hospitals into the behind-the-scenes analysis of malpractice cases. My vision was to create a system that addressed all of these issues. So I used some of my team building and online entrepreneurial experience and a little bit of my ninja spreadsheeting skills and began forming the ultimate dream team of nurse practitioners and other APRNs of diverse clinical backgrounds. I presently devote full time to managing this dream team of advanced practice registered nurses and other collaborating staff and clinicians, with the end goal being to bring medical malpractice attorneys and their clients not just one, but an integrated and connected team of highly specialized, highly functioning behind-the-scenes nursing and medical consultants, a versatile, usable work product that medical malpractice attorneys and their staff can control and adapt to the needs on the fly, and competitive pricing with easy-to-understand flat rate billing, no matter who sees your case. I know you are going to love our team of high-achieving advanced practice registered nurses who are so excited to spread the word about this new way to get behind-the-scenes consultation services so that you can have an airtight, winning case and to help you discover the NP advantage.
My name is Pam.
My name is Sierra.
My name is Deborah.
My name is Shelley, and I'm a nurse practitioner.
Nurse practitioner.
Nurse practitioner. Nurse practitioner consultant.
Consultant to the legal profession.
Consultant
to the legal profession.
And I'm a nurse practitioner consultant to the legal profession.
We are Discovery NP Legal Consultants.
Discovery
Discovery
NP Legal Consultants.
We provide non-testifying nursing and medical consulting services to attorneys
Like you who take medical malpractice cases for the plaintiff.
So maybe you've used an RN legal nurse consultant before.
Maybe you have one in-house.
Maybe you get away with paying her a little more than what she would make at the hospital.
But I hate to break it to you.
None of us knows everything.
In the medical world, we consult one another all the time.
When a general surgeon encounters a patient with a heart arrhythmia, he reaches out to the cardiologist.
When a cardiologist notices a patient's creatinine is too high, she calls the nephrology NP.
It's no secret that no single person knows everything there is to know about every condition.
How many hours does your RN consultant spend researching something that one of our specialists would know off the top of their head?
Right off the top of her head.
Look, I'm a hospitalist, not a surgeon.
And in the hospital setting where minutes can be the difference between life and death,
I don't have time to search online for 3 hours to find the answer when I can just call up the surgeon and ask.
That's my specialty. I'm an OR first assistant and a nurse practitioner. If I don't know the answer, for sure, I know the exact search terms. And I definitely know which sources are authoritative for the standard of care in my field. It's literally my job to know that.
That saves me hours over me just going it alone.
And that saves you and your client thousands of dollars.
So let me tell you a secret.
Do you want to hear something revolutionary?
Ever heard of a round table?
it's where a bunch of specialists in the hospital put their heads together in the same room at the same time on the same patient.
Why has no one done this in medical consulting for the legal profession?
Discovery works on your case as a team.
We even have a pharmacist and a radiologist at our fingertips.
Discovery NP Legal Consultant's simple but revolutionary approach to behind-the-scenes consulting on your medical malpractice case does just that.
It brings medical collaboration to the courtroom.
And that saves you and your client thousands of dollars.
How does it work?
Discovery NP Legal Consultants assigns your case to a team lead nurse practitioner consultant to the legal profession.
If, in the course of the review, the team lead NP CLP needs access to, say, a pharmacist, a radiologist, or another specialty NP, she can just pick up the phone and call that team member.
No additional retainer to you or your client.
What's more, no matter how much collaboration is done behind the scenes, you'll only get a single, simple, itemized bill with one entity.
Discovery NP Legal Consultant.
The outcome of your behind-the-scenes consultations is an airtight case that's organized, relevant, comprehensive, versatile, usable, and
Collaboratively done.
Come try the team approach, because it's about time.
Discovery NP Legal Consultant is bringing medical collaboration to the courtroom. My name is Sierra.
My name is Shelley,
My name is Alicia.
My name is Pam.
My name is Lisa.
My name is Deborah.
and I'm a nurse practitioner.
Nurse practitioner,
Nurse practitioner.
Nurse practitioner consultant.
consultant to the legal profession.
Consultant.
Consultant.
Consultant to the legal profession.
And I'm a nurse practitioner consultant to the legal profession.
We are Discovery NP Legal Consultants.
Discovery.
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 Discovery
Discovery NP Legal Consultants.
We provide non-testifying nursing and medical consulting services to attorneys
Attorneys like you who take medical malpractice cases for the plaintiff.
To date, we are the first and only.
The only group.
the only group of exclusively NPs providing this service to your community of medical malpractice attorneys.
We've got you covered.
We're nurses too.
Collectively, we have over 100 years of clinical experience.
I've been a registered nurse for 17 years.
15 years.
14 years.
I've been a registered nurse for 19 years.
For over 43 years.
I have worked in multiple areas in and out of the hospital settings.
I've worked for over 30 years in the operating room.
I've worked in orthopedics,
Adult critical care.
Hospice.
12 years in neonatal intensive care.
Cardiovascular ICU.
Flight nurse.
neurosurgery,
Plastics,
Public health.
Medical general and surgical and cardiac surgery.
Urgent care,
Burn unit.
I've helped surgeons with ENT.
case manager nurse in a skilled nursing facility.
Corrections,
Pediatric critical care.
Let's see, where else was I working?
I was an ER nurse.
I've assisted in spine surgery.
Labor and delivery.
privately held insurance companies,
Pediatric head trauma.
And then I became a nurse practitioner.
I became a nurse practitioner.
and then I became an NP.
Then I became an NP.
And then I became an NP.
As a nurse practitioner, I worked side by side as a provider with my physician peers.
Just like doctors, nurse practitioners diagnose and prescribe treatments and medication in many states independent of physicians.
As an NP, I've worked in spine surgery.
Urgent care,
Long-term care and skilled nursing facilities.
Pulmonary.
Aesthetics.
7 years in neonatal intensive care.
As an NP, I've worked in OBGYN and women's health.
Internal medicine.
As a nurse practitioner, I've worked 27 years in pediatrics and pediatric critical care.
I've worked 5 years in critical care.
And I also have an Ohio and National Registry paramedic certificate. Between us,
We've seen it all.
Did you know NPs have 2 to 4 more years of academia than your average RN?
NPs are masters.
or doctorate prepared. I have a doctorate of nursing practice.
That means we've had more experience in research analysis.
And a lot.
A lot more writing.
and a lot more writing.
Just like nurses, our nursing education is broadly based.
But we are also well versed in medicine.
Sure, we can fill in the gaps of you and your staff's medical terminology.
And get you up to speed on human anatomy and pathophysiology for your case.
While also speaking to the standard of care.
And pointing your case in the right direction.
Before you drop thousands on an expert witness at a much higher rate, NPs are providers.
Peers with physicians, but we don't charge you physician rates.
Remember, we've worked in the trenches as RNs in the hospital.
We know all about how things function day to day there.
But now we're where the buck stops.
Now we are where the buck stops.
Sure, you could get help cheaper by the hour, but you get what you pay for. Is a 300-page summary really more useful to the judge than the original 4,000-page medical record?
What you need is a 4-page summary of what's most important.
But those flat rate providers in foreign countries or minimum wage chart reviewers don't know what not to include. And you're not going to get opinion.
And you're not going to get a competent literature review done by a specialist in the industry who knows what to look for.
So what takes your legal nurse consultant RN 3 hours will take the right NP specialist a lot less time.
A lot less time.
And for a limited time, we're offering introductory pricing that is 10% below your standard legal nurse consulting rates for RNs in the industry.
But we're nurse practitioners. Emphasis on the practitioner.
Let us help you
Let us help you discover
Discover
discover the NP advantage.
Discover the NP advantage.
Discover the NP advantage.